Hi guys, welcome back to my channel. So today I actually wanted to start a series titled Love, Sex and Partnerships. But I actually realized that in the next week or so, the most important thing for any aspiring psychologist is going to happen, and that's Master's Selection Week. So I've decided that first I'll start posting this video on just tips and tricks on what to expect during the selection week, and just to give you guys a bit of tips on what it is that they're looking for during selection week. Before we get into it, don't forget to like and comment, as well as subscribe and hit that notification button so you don't miss out on anything. So I've written down a couple of things that you guys need to be aware of with regards to selection week. And if guys you're not going in for master's interviews, there is definitely someone within your circle or someone that knows someone that's actually going in for master's interviews, and this would be a really helpful video to actually watch, because I remember how anxious I felt about going into master's interviews. Like literally it's a life-changing sort of interview, and you definitely need as much input as possible. And I really struggled to get any information about what it is that it actually happens at the interviews, the type of questions that they ask. Guys, literally I was there on Google, I was on YouTube, I was on Facebook, but I really struggled to get any information. In fact, I didn't even find one video of anyone that told us about their experience during master's interviews. So guys, please get people to actually watch this video, because it will be helpful, particularly for those people going in for interviews this year. So generally there are 4 tasks that you do at the interview. You might do all 4 tasks at one institution, you might just do 2, or you must just do 3 of them. So the task that you guys actually do is, number 1, you have the actual interview, which is you might have one interview with like a panel of people. Or if you go to a university like Rhodes, I remember they divided us amongst 3 people, and we went to 3 different interviews, and then there was one huge panel interview. Then you guys also have role plays. And then, so basically I'm just going to highlight some of the stuff that you guys do and then get into more detail of each one individually. So after role plays, you have group tasks, and then the last thing is a written task. So I'll start with the written task. Generally, the written task is one of 2 things. One of them is a research paper. So basically they give you like a research paper, and you'd have to write like an abstract or a part of that research paper that's missing. And basically they're trying to get a sense of whether or not you can actually write an academic paper, because half of your degree will be a research component. Then the second other task that you might do is a diagnostic one. So basically they'll give you a case study, and you'll read through it, and then you need to diagnose whatever you think or provisional diagnoses that the client is presenting with. So basic things like depression, the most common mental disorders, depression, anxiety, as well as schizophrenia, because they like to see whether you know and can identify psychotic symptoms. So I would suggest that you guys really look at those criteria: depression, anxiety, and schizophrenia, or any psychotic sort of symptoms. And then with regards to the group task, so basically every group task is quite different, but they just want to see how you engage within the group, because in a master's program, guys, like literally you are part of a group. That group becomes your family. So the dynamics of the group, and you guys are a really small group, it's like 6 to 8 people. I know some universities have like 10 max, but it's quite a huge group of people. It's quite a small group of people. So the dynamics within the group are very important. And during the group task, they want to see how you engage within a group setting. Are you a person that's domineering? Are you a person that's quite reserved within a group? So I would suggest, like, within any group task, if you guys get a group task, make sure that you do contribute to whatever discussion you guys are having. Also, if you see that someone within the group is not saying anything, literally invite them to talk. Don't now like be domineering and be like, no, enough, you must speak. But just invite them in a very gentle and friendly way to actually engage in the conversation. They'll see you actually have leadership qualities. You're considerate of other people and you want to get them more engaged in the task. So those are the type of things that they'd be looking for in a group task. And then you have the role play. Guys, role plays are my favorite and I absolutely love them this year because I am going to be the client. So whoever is coming in for UCT interviews, you might just get me. But role plays, I remember I was very anxious about role plays because I don't have any, I didn't have any counseling experience before coming into the master's program. So I didn't really know what I was supposed to be doing, what would be expected of me. And guys, literally it's a no-brainer. Literally they just want to see how you are in the room. How do you engage with the client? How would you engage with the client? How do you interact with people? So literally just be yourself. Don't now walk in and start wanting to be a psychologist and start asking people how they feel and what does that mean for you. But basically what you're supposed to go in there doing, you're not supposed to diagnose. Don't even try to diagnose. They will literally bash you for diagnosing. They will write you off. So what you're actually supposed to be doing there is being empathetically present, like engage with your client, show them that you're interested in understanding their story from their perspective, their experience, and just get an understanding of what it means for them, how they feel about what it is that they're going through. So stick to their emotions and just the experience of whatever the client is bringing to you in that role play. And also be mindful of the things that you're struggling with, because after the role play they're actually going to ask you things that you actually struggled with, things that you feel you did well, things you need to improve on. So you need to be mindful of just your strengths and weaknesses while you're actually in that role play. But also just have fun with it. Just show them who you are. And yeah, the role plays are definitely something that I personally enjoyed. And then the very last thing, which is the actual interview. Guys, I cannot stress this enough. Like, this is it. Like, this is the crux of the thing that you're going in for masters for. So basically, the interviews are quite different depending on which university you're going to. And maybe in the end, I'll just touch on like which universities focus on what. But the type of things that they'll ask you is, tell us about yourself. Guys, like when they ask you this question, you need to draw on your autobiography. You sent in an autobiography and they want to know the person you wrote about in that autobiography. So draw from some of those experiences and describing who you are. Don't now talk about I have 3 sisters and all of that. Literally draw on those experiences and how they've molded you into the person you are. And if whatever you wrote in your autobiography, it's things that you still feel quite emotional about, guys, I would suggest go out there, tell as many people as possible. Like, talk about it, tell your friends, tell your family, literally talk about it until you get to the point where you've literally processed some of those stuff, and it's not so difficult for you to actually talk about those things. Because what will happen is during the interview they'll ask you very difficult questions about those experiences, and they want to see whether you're an emotionally resilient person, that you're able to, even with these quite difficult experiences, you are able to grow from them, to learn from them. And if it's something that you're still struggling with, like, do bring it up and say, yeah, as much as I went through this, but I still feel like I'm processing it. It's something that I'm still working on. Because trust me, they will pick it up. And also just be yourself. Like, when you're speaking about who you are or whatever it is that you're saying in the interview, just be yourself. Don't try to pretend to be like this person that will attract them to you and into the program, because they will see right through that. Just be your authentic self. Be like the realest you've ever been. And then also just to touch on the autobiography stuff a bit more, because literally, guys, like, this is the important stuff. you also need to take into account that you can't just go in there and spill out all your business. Yes, stick to the stuff you've mentioned in the autobiography. If you want to bring something else up that's new, you can bring it up, but make sure that you're not now like bringing all your business and your baggage to them, because some of those things might be difficult for you to discuss, or some of those things might actually just set them off because it's not something that they saw in the autobiography, and it might catch them off guard. And I don't know, man, like these people, it's quite a subjective thing, so it's quite difficult to know what they'll like and not like. But if they've liked you and you've made it to the interview, that means they love your autobiography. Stick to that. And then they'll ask you to tell them more about why clinical psychology or why counseling psychology or whatever it is that you'll be going in for. Like, guys, don't now say world peace or you want to help people. Like, honestly, they will not listen to that nonsense. Draw on your own experiences. Speak about how because of your experiences and this and this and that, you became interested in understanding. For example, for me, it was more about my own childhood experiences, and the trauma that I experienced resulted in me acting in certain ways that I didn't really understand. I didn't even understand my own emotions, and because of that, I wanted to learn and understand them. And through psychology, I've grown an interest in actually understanding human behavior, their emotions, and basically stuff like that. Like, draw on your own personal experience. They don't want you to say you just want to help. Like, we all want to help. That is not helpful. And then another thing they'll ask you is the difference between clinical and counseling psychology. This question might come up in several interviews, and basically they're just trying to see, like, do you really understand what it is that you want to be doing, like what it is that you'll be doing. So if this question does come up for you, there honestly isn't much of a difference between clinical and counseling psychology. In practice, you might actually see someone that got trained in clinical psychology and someone that got trained in counseling psychology because of their use of theory and things like that. But the honesty is, we all get trained in the same program. We all take the same route. The only difference is that clinical psychologists actually do pharmacology and counseling psychologists don't. And the most important difference is that clinical psychologists do their internship at a psychiatric hospital, whereas counseling psychologists do their internship at like a university counseling center. So you need to know those differences. And then they might also ask you about, like, why did you choose specifically their program? Like, why UCT or why VITS or why Rhodes? So you need to know about their specific program. Know the psychotherapeutic orientation that they use. So is it psychodynamic? Is it CBT? Is it DBT? Is it psychoanalysis? And why it is that you would want to be particularly in that program. Like, know the client profiles that are seen predominantly in that clinic. Is it like, as child guidance clinic, we see mostly children and families? Is it more like adult? Why is it that you would want to work with that specific group of people? How would you benefit in terms of your career, particularly through their program? And also they'll ask you, like, why you? Like, why must they pick you over everyone else that's coming for the interviews? Draw on your past experience. Like, you've done this, you've done that, you've lived in different places, you've had many experiences. So draw on those type of things. And they'll also ask you about your work experience. And if you're someone like me that had absolutely no experience within the field of psychology, in the sense that I had never counseled anyone, and I'd literally never been in any of those things. But if you've had your own therapeutic journey, so if you've been to some sort of therapist, or you've been part of anything like that, like, draw on that experience and how it molded you into the person you are, how it contributed to your knowledge and understanding of the field. Also draw on things like, if you've worked with different groups, like literally volunteered at different organizations, starting from like infants and all the way to like old age homes. So if you've worked with people from different backgrounds and different sectors, that is experience. Don't think that you need to have sat in a chair and counseled someone to have some sort of experience within the field. Like psychology is a relational thing. So if you've worked with different people from different backgrounds, speak to that. Speak to how it actually gave you an edge over everyone else. And if you've been someone, like for example, I come from a small town and I've lived in different cities, I've even been to a different country, like speak to how that experience will actually help you within the field of psychology. And then they will also ask you, what am I forgetting? They will also just generally ask you about maybe even your theoretical orientation. Which theory would you want to work from? So you, like, guys, like, be smart, use whatever it is that they're using, but be able to back it up. But just one last thing that I got asked, and it sort of just became a thing for every university, is age. Like, I was quite young and I still am. I'm like the youngest student in my class, so age was really an issue that but just be able to back it up. Like, I just told them that just because I'm a specific age, literally that's just a number. It speaks nothing to my experiences in terms of my life experience. It doesn't say anything about just my level of maturity. So be able to back up such questions, and if they do come up, don't get defensive, but still be quite open and quite neutral about things, and be able to sort of be able to back yourself up in any question that may come up. I think that's basically everything that I hadn't covered. But just to give you guys an idea about the universities that I did go to, and a few universities that I've spoken to some of my colleagues about, I know that UKZN is more focused on research, so they'll ask you a lot of research questions. UCT is more focused about who you are. They want to see if you're an emotionally resilient person. What did you take away from your experiences? And then Rhodes was quite a well-rounded university interview. Like, I genuinely loved it. It was a great way for me to learn and prepare for all the other sort of interviews. And basically, they asked me even questions about the South African context, like what's currently happening within the South African context, what's our role as psychologists. So you need to know things like critical emancipation of people through psychology, clinical psychology outside the consulting room. How can we bridge that gap between the haves and the have-nots, because majority of South Africans can't really access our services as psychologists. So how could we go about bridging that gap? So literally be in the know about what's happening in South Africa and your role as a psychologist, and sort of improving and bring about social justice within our society. And then I know Wits has quite a different process. Most of the stuff that happen, like role plays and things like that, they actually happen in front of a panel of people. So it's not like with other universities where you do the role play in a one-way mirror. So you're alone with the client in the room and someone else is just observing you in a one-way mirror. With Wits, you literally sit in a panel and you do most of the tasks that you do during the interview process within that panel sort of setting. So yeah, I think that's about all that I can think of right now. So if you do have any other questions, please feel free to put them in the comment section, and then I'll speak to you directly and address some of those questions and concerns that you might still have. And also, guys, please give my video a thumbs up, and don't forget to subscribe and hit that notification button so you don't miss out on anything. And guys, like, do yourselves a favor, do not miss out on my next series, which is titled Love, Sex and Partnerships. Thank you so much for tuning in. I'll catch you guys next time. Mwah.